Hello, this is Dr. Do again. This video is still on alphabetic list problems on letter S. Today I'm going to talk about a disease, probably not commonly heard or not common occurred or underdiagnosed probably. The disease called Sheehan syndrome. This Sheehan is a physician's name. This is actually, I think, regardless, this is it's not an emergency situation usually. It's associated with childbirth actually. This is I think probably in the first half century of last century, probably 5 or 6 decades ago, when the medicine was not quite very well developed, especially the childbirth process associated with a lot of heavy bleedings. So this is the Sheehan syndrome is basically is the ischemic of the pituitary gland. If you recall, I think a pituitary gland is one of the endocrine organs in the brain, and the middle level of the endocrine axis, if you recall, I mentioned hypothalamus, and also the pituitary, and also the other level of organs, which they all have the function of endocrine to secrete hormones. So if you recall, the pituitary responsible for a lot of the stimulatory hormones, for example, thyroid stimulatory hormone or any other hormones in response to the hypothalamus. And also pituitary hormones to function at the third level of endocrine organs like thyroid or the reproductive organs or the adrenal gland, for example. And this is the integrity of the endocrine axis. And of course, those target organs is either the muscles or either the any of the metabolism or reproduction. So this is about the endocrine axis and the pituitary. Just a remind about the pituitary gland. In addition to the secretion of the stimulatory hormone, for example, thyroid stimulatory hormone or ACTH, or pituitary gland also responsible for other hormones, for example, the antidiuretic hormones, oxytocin, which is from the posterior of the pituitary gland, and the anterior part of the pituitary gland also had the other hormones, for example, prolactin. So this is the introduction of the pituitary gland hormones. So this Sheehan syndrome is usually occurred with massive bleeding during the childbirth, and postpartumly the patient developed this kind of symptoms, which means really the collapse of the endocrine axis, which typically like no lactation because the prolactin cannot be secreted, or a couple weeks later, like 4 to 6 weeks, no menstruation like normal, because this decreased FSH, follicle stimulatory hormone, and luteal hormones, and also intolerant of cold. That's probably lack of the TSH, which means cannot generate enough of thyroid hormones. So this is about the Sheehan syndrome. I think this is very well talked in the education purpose. Probably is because it used to be quite common, like I mentioned in the beginning of last century probably, and nowadays because of the medication advancement, and usually if there's any risk of bleeding, and the medication or surgical management to prevent it. So probably the Sheehan syndrome is not quite common. However, there are a lot of women after childbirth have this kind of symptoms, not meet the criteria for Sheehan syndrome, intolerant of coldness, just partially probably low function pituitary gland or endocrine functions, hypothyroidism undiagnosed. So I think there's it's not a research or evidence showing that those are part of the partial ischemic of the pituitary gland, or just the whole readjustment for this endocrine axis to maintain the new level of homeostasis. So anyway, so this is about the Sheehan syndrome. In terms of the risk factors, it's usually for the heavy bleeding during the childbirth. I think the placenta abnormality is one of the risk factors. Usually the placenta just attached to the endometrium of the uterus, if you recall, the 3 layers of the uterus: endometrium, myometrium, and the serum. The outer layer, serous membrane. Usually the placenta just implant in the endometrium, but if the placenta are going deep through the myometrium, so during the after the childbirth, there's a difficulty to separate this placenta, or falsely separate cause massive bleeding. So that's one of the most common risk factors to develop this Sheehan syndrome. Or whether during the childbirth the injury is too massive and bleeding too heavy, that's all increase the risk. However, because of the medications or because of the surgical, if this deeply implanted placenta, accreta or increta or accreta, so this is just usually can be diagnosed before the childbirth. So if that's the case, the surgeon, the obstetrician will manage it accordingly. And also the medication oxytocin, if there's a after postpartum or after childbirth, the placenta lost the strength to contract to stop bleeding. Oxytocin can serve the same purpose to stop bleeding. So this is why Sheehan syndrome is not quite commonly seen or commonly diagnosed condition. So this is about the Sheehan syndrome. I think the take-home message is for basic knowledge of the endocrine axis, pituitary gland. I mentioned about the major hormones of pituitary gland, and also for the structure of uterus. I mentioned 3 layers of the uterus, and also the most important on top of those is during the pregnancy, follow up with your physicians regularly and do the screening normally, and postpartum follow up with your physicians. If you develop any of the symptoms I mentioned, lactation problem, no milk production, or no menstrual period after 6 weeks, or long-term just feel cold intolerance, I think you need to talk to your physician, even though it's either your obstetrician or the primary care physician to diagnose the problem and to help you, because cold intolerance is quite common, and sometimes it's probably it's not just cold intolerance. On top of that, might indicate some serious problem, and also if you see a physician to test the hormone level and to diagnose the problems, and also to improve your life quality. So this is about the video of Sheehan syndrome. It's not quite common, but it could be not commonly occurred, or could be underdiagnosed, or could be really it's not a big concern for the physician nowadays. So this is about the video here, and hope that if you're interested, you can search the pituitary gland, find out the function, and also hope it helps. Thank you for watching. I'll see you next time.